couple things. First, the aggregate amount of subsidies. If you do a static analysis and say who's getting subsidized now, how would this change with the new system, and Steve mentioned a very excellent Kaiser study that's run a lot of numbers here, the data suggests that the aggregate amount of subsidies paid, the aggregate amount of support would decline, but in reality this will depend very much on projected premium levels and how they might change under any new regime, as well as take-up of coverage. As far as the growth in the credits over time, if you just extrapolate healthcare cost growth at 4 or 5%, compare that to CPI plus 1, you can get numbers that suggest that the tax credits will be increasingly stingy over time in terms of being able to pay for health insurance. But everything very much depends on the details and the features of any legislation that affect the risk pool balance, premium levels, and the flexibility in terms of buying coverage. Now let me go with the hot button issue is targeting in relationship to income. At current and near-term projected premium levels, minimum benefit requirements, the tax credits generally will provide lower support to those with the lowest incomes compared to the ACA premium subsidies. And the Kaiser study documents that. It'll tend to provide higher levels of support for people with higher incomes. And higher here can mean 220, 250, 270, 300% of poverty level. If you just run static numbers, many people will get more support under the proposed tax credits than they would under the ACA system. This is certain, obviously, to be a point of controversy, and again, the magnitudes will very much depend on the details and other aspects of the legislation that would affect premiums and affordability.